Darren,
Oh, Richie,
how you going?
I've got to talk about voluntary assisted dying, Richie.
What's going on?
Well, the staff need to know about it.
Really?
Really.
Glad you asked. We're working on a little project. It's like a skit. You're DW, I'm RD.
You're kidding me.
No. Do you want to give it a go?
Righto.
So if you come in.
Richie, we need to talk about voluntary assisted dying.
Sorry, Darren. You know the rules.
But we need to make sure our staff...
Darren, you know that we're not allowed to raise the subject of voluntary assisted dying. We can only respond to our patients and residents if they raise it.
I know, Richie, but we need to make sure our staff know how to respond if a patient or resident asks them about VAD.
VAD? What's that?
Voluntary assisted dying.
Ah, yes, of course. Go on.
Well, as you know, we've got a policy in place and we've drawn up a table to help different staff groups know what to do.
Yes, drew it up myself actually. With a bit of help from the lawyers. What do you think? You good?
Yes, Richie, it's fantastic. But how do we know that all our staff have got the message?
Well, we emailed everybody.
Yes, but not everyone's reading emails every day like you and I do.
What else would they be doing?
Working, you know. Caring for the sick and elderly.
Ah, yes, of course. So what's the main message we want to get across to them?
Well, firstly, staff need to be aware that not every time a patient or resident talks about dying, that they're actually wanting to access voluntary assisted dying.
VAD.
Yes, VAD.
Can you give me an example?
Well, a patient could say to one of our nurses that they feel like dying. That is not a request for VAD, and the nurse doesn't need to respond by saying we can provide them with information or guidance about how to access VAD. Conversely, a patient might say they've heard about voluntary assisted dying and would like to know more about it. In that case, staff should respond by saying, for example, "You've asked an important question. Let me speak to my manager and come back to you with some information about voluntary assisted dying."
You've got really more lines than me. Okay, so the main thing is that we treat any possible query about VAD very seriously, but also to get help from our manager if we have any concerns about how to respond.
Correct. And as you mentioned earlier, it's important that our staff never raise the subject of VAD in the first place. If they do, they could be breaking the law.
Okay, so this is really about just as much about looking after our staff as our patients and residents.
Pretty much. But staff should also know that they don't have to do anything, have anything to do with VAD. They can conscientiously object.
What's that mean again?
It means that for whatever reason staff don't want to be involved in VAD, then they don't have to be.
What if they get asked about VAD?
We would still expect them to respond respectfully and say something like, "You've asked an important question. Let me find someone who can assist you with this question."
That sounds reasonable.
So the question is, how do we make sure our staff know about this?
Well, their managers should discuss it at staff meetings.
They've been reminded.
We could put something on the intranet.
Already done.
Good. We could add a VAD session to Staff Orientation Day program.
Planning's underway.
We could do a staff survey in a couple of months to see what everyone thinks.
I hadn't thought of that, but good idea. But will this all be enough? I'm not sure.
We could do a song, like the flu shot and the People Matter survey one. Got people talking.
Richie, I'm not so sure the subject lends itself to this type of promotion. And anyway, I can't think of a suitable song that you could use. Can you?
Stairway to Heaven.
Oh, Richie, I don't know. Maybe not this time.
Okay, I'll get the message. I know we have a no-blame culture here, but Stairway was Meredith Finnegan's idea. Okay.
We've got to get this right, Richie.
Agreed, Darren. We seem to have run out of ideas.
What are you two up to?
And Melanie?
We're just trying to make sure we've got the bases covered with VAD.
Voluntary assisted dying.
Have you tried the Voluntary Assisted Dying Care Navigation Service?
I was about to mention that to Darren.
The VAD Care Navigators take queries from anyone, and part of their role is to provide education to health services.
Thank you very much, Melanie. Do you know what the number is?
03 8559 5823.
Thank you very much.
I still think a song might help.
Oh, Richie.